It gives me great pleasure to welcome Angus Pringle onto Mind Movers. Angus is a specialist orthodontist who became a consultant orthodontist and is now working in a specialist dental practice, Wessex Dental Specialist, one of the top practices around. Angus has an interest in suicide and mental health, particularly as it pertains to dentists and to others. And wearing a jersey from your cycling. Just tell us what the jersey is. Welcome.
Yeah, thank you very much. Yeah. And I really appreciate being invited onto this because it's such an important issue for all of us, not only in dentistry, but in the general population. So my friend and I just recently completed a cycle challenge in Belgium called the Flandrian Challenge, and it was to raise awareness of suicide prevention. And the reason we chose the challenge was it's not a race. Just like our mental health isn't a race, there's no end point. But it was an attritional ride where we're having to ride over cobbles. And I've never ridden on cobbles, neither has my friends. And on day one, after the first set of cobbles we rode on, we were shocked how difficult it was. And it was an all-encompassing mental battle to keep going. And that's like someone who might be struggling with their thoughts, particularly suicidal thoughts. So we documented our journey on social media, talking through the well-being that we can use to get through these difficult times. And we both had difficult times for our mental health in those 3 days. As we were going through, we had horrendous weather. It was wet. I broke my back wheel. I got punctures. I had times that this was the last place in the world I wanted to be. But we were talking about two charities that are really close to my heart, which is the Baton of Hope. And the Baton of Hope's relatively new charities focused on suicide prevention. And I took part in the tour last year in London, where we were walking through London with the baton, and we're talking to the general public, raising awareness of suicide prevention. And it was an incredibly powerful and emotional thing for me to do, because I was doing it on behalf of my brother who had sadly lost to suicide. And it had taken a long time for me to be able to stand up and say, look, we need to do something about it. I want to talk about it. I want to share our journey and the things that we've learned, but most importantly, show that there's recovery and that there's hope. The other charity that I'm deeply passionate about is the Canmore Trust, which isn't that well known, possibly down in England, but is based in Scotland. And it's a dear friend of mine, John Gibson. Tragically, his son died by suicide. And John Gibson is a professor of oral medicine who happened to teach me when I was at Glasgow Dental School. And John's son was a vet. He had no mental health conditions, and all that John and the family knew was a knock on the door from the police. And subsequent to that, it had a devastating effect on their lives. And everything they've been through, they then went on to form the Canmore Trust. And the point of the Canmore Trust is creating safe spaces for lives impacted by suicide. And they're deeply involved with dentists, medics, and vets, because they've got a higher risk of suicide compared to the general population. And I was recently speaking with John, and they're involved with supporting people going through the fitness to practice at the GDC, which is obviously very important. And there's a lot of things that we need to talk about and really move forward with our compassion when it comes to regulation, not only in dentistry, but medicine and veterinary surgery. But they also do something that's incredibly unique and something that we never have as we lost my brother Andy, which is postvention, which is support to families and individuals who've been bereaved by suicide. Because one of the tragic things when you lose someone to suicide, it's very isolating. I didn't really know anyone who's ever died by suicide. I never thought it was going to happen to me. That's probably where the stigma comes from. Somehow I thought that we were immune. We were a good family in inverted commas. And in that devastation, life changes. It's never the same again. But how do you find purpose? And we've had so many impactful conversations, John and I, and I've got purpose certainly in my family and my work, but there was kind of that itch. My purpose really, with that protected environment, is really discussing mental health, breaking the taboos, breaking the stigmas, also really looking at suicide prevention. It's such an important thing. We can't keep losing our men and women to something where the researchers will say is preventable. And unless we talk about it, we can't stop losing people.
Thank you so much for sharing that. Honestly, you've moved me so much. The whole reason why I started Mind Movers was to open up the conversations. I think Payman thought I was a little bit crazy a few years ago, and he said, I don't think anyone wants a bit heavy, Rhona. And then obviously mental health was something that was, I don't want to use the word trending, but I think people were opening up to the conversation. Healthcare professionals definitely feel that it is their duty to show some kind of self-preservation. I think maybe because we view ourselves as healers in society. So to show vulnerability is to show weakness. Yeah. But I would argue and say that to show vulnerability is actually a superpower. Yeah. And the more that I've opened up the conversations, not only do I feel better, but I also feel connected to a wider community. So yeah. I'm really grateful there are people like you out there and someone that's been able to come onto this podcast. I want to know, though, how old were you when the event actually happened to your family and yourself?
Gosh, so I lost my brother in 2005, which was that 19 years ago?
Okay.
And it feels actually like yesterday. And it just happened to be, it was Andy's birthday on the 10th of September, so was that a couple of days ago, which also now is World Suicide Prevention Day.
Wow.
And that it's got so many mixed emotions, in some way it's ironic and cruel, but I've started to think it's actually quite motivating. What is Andrew's legacy? It's like, we don't want someone to be in the position where they feel they need to take their life, and I don't want people to have that loss, that tragic devastation. And after we lost Andy, we'd talk to people and say, Andrew died by suicide. And for a while, that was fine. But quite quickly, unfortunately, we quite quickly realized the stigma surrounding it. And there was quite a lot of negativity. And not very nice comments that were being made, and for actually a very long period of time.
So was this the 80s then, or 90s?
No, this was 2005.
2005, okay.
Yeah. And we are kind of in a slightly more modern time now, but still the thing is, it's the people that you might speak to and actually having the right people around you. And for a very long period of time, I actually didn't talk about it. I'm really ashamed to say that we had some circumstances where I might meet new people and they ask about family, and I wouldn't acknowledge that I had a brother because I just didn't want to get into that conversation. It's like, what are they going to bring up? And for me, it was the end of 2018. I had a really unpleasant incident with comments about Andrew and now also myself. I then made the decision, I'm going to talk about it. And if people don't like it, that's their problem, but we can't keep going on where we're losing people. And also the people who are bereaved, they can't be in this isolation because there's too many people who are in this difficult position. We've got to talk out. We've got to support people.
Would you say the grief that a family feels after someone takes their life by suicide has its own particular characteristic that's different to if someone passes away a different way?
I think that
guilt a bigger part of it.
In the greatest scheme of grief, it's important to acknowledge everyone has a different experience, and I think what I went through was very different to what Andrew's fiance went through, to what was different to what my parents went through. But there's two big areas, which is guilt and shame. The guilt of thinking, what could I have done? And that could really torture you. And the shame really surrounding the stigma, whether it's our own internal stigma or the stigma that others place on you. And the consequences of living in a family after a suicide, it can do devastating things to the family network. The statistics on marriages that break down after suicide, it's certainly affected my relationships with people. It would put a massive strain on my own marriage. But, you know, we were the fortunate ones that we battled through these difficult times. And Kevin Hines is a mental health campaigner in America. He's very famous for surviving a suicide attempt. And one of his expressions is, he's cracked, but he's not broken. And I would certainly say that, you know, I've got the scars of what I've been through before. I've come through it, but because of what we've been through and what we've learned, we can certainly talk about it and help others to avoid these situations happening again. And in the tragic situation, if someone does lose someone to suicide, being in a better place to really offer support, really.
So I got a book in the post a few months ago, When It's Darkest.
Me too.
And didn't know who it was from, and I was really touched. It was very personal to me because I'm very vocal about my mental health and being gone through those really, really dark times. So I thought maybe a patient sent it to me, or one of my friends messaged my therapist, my coach. No one was like, no. And then lo and behold, we found out today it's from you. So
yeah.
And I really, you know, I'm a very slow reader, ADD diagnosed now, so I take a long time to read things, and I have found it an incredibly compassionate book, but I think that I've known 2 people to lose their lives via suicide. So the first one was a boy at university who was very good looking, very popular, had a beautiful girlfriend. I think he'd always struggled, had gone on a holiday in Ibiza with a group of friends, came back to university and took his own life. He couldn't cope anymore. And I remember we all went to the funeral. I think one of the most difficult things was as well, he was Jewish, and there was a lot of stigma within religion. And I became very aware of the religious narrative around his death. And that made me feel a certain way. I had also gone to school with a girl who became a very famous Bollywood actress. And she was best friends with my best friend, and again led a troubled life in the limelight, as it were, and had also died by a suicide. But unfortunately, as you've already alluded to, her mother tried to pinpoint it as murder. And I think there was definitely an element of cognitive dissonance because you, as you said, the people around you bear this responsibility and guilt and shame. So it's almost easier to blame something else, you know? And I remember that being extremely heavy because things turned quite ugly from a legal point of view as well.
I mean, it's crazy that the stigma of suicide was more than the stigma of murder.
Correct. Of course. Of course.
Well, it's mad. That's a mad situation.
But I think that's the whole problem I have around the narrative of mental health, and why I'm so grateful there are people like Angus in our industry. I went to go watch Gabor Mate on Monday, and it was it was amazing. But I think what really struck me the most in the talk was, I mean, he didn't say anything that was completely blowing my mind because I've read so much of his work, and there were a lot of people in the audience that had felt very impacted by his life. But what really struck me about what he said about mental health was, he said that a lot of healthcare professionals will say that someone that doesn't suffer from mental health is the absence of disease, but they don't actually state what being mentally healthy is. So it would be not depressed, not anxious. Do you see what I mean? But okay, but then what is actually being healthy in mental health terms? And for me, I was really thinking about that. We don't actually know because it's the absence of some kind of medical disease, but that doesn't really mean anything. And for me, I was trying to explain this to my father yesterday, who is an old school gynecologist who is almost 80 years old. And I was also trying to explain to him how so many autoimmune diseases have now been linked to mental health and so forth. My dad was like, I think this is rubbish, you know, like he recognizes that stress can have, but he recognizes that stress can impact, but he also, you know, is very much, you have an autoimmune disease, you treat it this way, you know, this is the medical route, etc. And I think that's a huge problem. I really think it's a huge problem in our profession because we are so used to seeing symptoms, giving a diagnosis, and then like trying to alleviate it with a treatment or medicine and not going back to the body. And I want to say, Are we really going to claim that the mind and the body are totally separate entities? It's practically impossible.
Do you know, you've really described it well. And do you know, the concept we need to think of is mental fitness, not mental health, just like physical fitness. And that's something I've worked at over the years, is physical fitness with cycling. And that comes on, it's on a sliding scale, really. I'm not fit or I'm very fit, but there's no kind of middle ground of what is average fitness. And I also think of my own mental health on that is where am I mentally fit? And I've had better times of mental fitness and worse times of mental fitness. And changing the rhetoric around it is probably a better way of understanding it. But you've just really described it better than I have, really.
Yeah. So I want to ask you, there's a few things. I always claim this, and people say, back it up with lots of stats, and there's a bit of airy-fairy stats, but does dentistry have one of the highest suicide rates of any profession? My husband will argue with me and say, finance is really up there, etc. I mean, I don't know about the finance bros, but what are the stats out there, Angus, regarding dentists and doctors and so forth?
Well, when you actually think about statistics, it's actually quite difficult. We know we've had a very sad increase in the number of people who've died by suicide in the UK. We're about 6,600. But we know there's certain professions that are higher risk, such as dentistry, medicine, veterinary and nursing. And medicine's actually slightly higher than dentistry. But it's still tragic. But you can also look at the construction industry. They also have similar issues with a higher suicide rate. Marginalised people in society like refugees, LGBTQ community, neurodiverse. But I don't have the figures on hand. And also, unfortunately, people who've been bereaved by suicide have a higher risk. So I sadly have a double whammy, being a dentist and someone who's been bereaved. But just because someone has a higher risk, it's not a fait accompli. But I'm just a little bit more mindful of my own well-being and understanding how my own emotions work to make sure that we are staying as mentally fit as I can. Yeah.
So you talked about prevention, and in the book they talk about prevention as well.
Yeah.
So how, in your experience, your view and understanding, do you think it can be prevented?
When we talk about prevention in general, there's some good concepts, but to prevent just one suicide is very more complicated. You're starting on a societal level of reducing inequalities, breaking down taboos and stigma around mental health so people can access the care. Can they then access care over a good long period of time? I think the factors around prevention is, if you think about dentistry as well, it's the environment that we're working in. If you think about the NHS and what that's gone through, and I used to work in the NHS and I knew that wasn't good for my mental health.
Same.
And I know you've talked about the same thing as well. But I'm interested in both of your opinions on this, because I appreciate that this isn't always necessarily me talking about it, but it's your feelings and understandings about where we can go with prevention.
It's difficult. So off mic, we were talking about this sort of escalator of, can a conversation like this stop someone who's decided to take their own lives to not take their own lives? And I was saying I was a bit skeptical about that. And do you remember we were saying, what do we call this pod? And we said, call it mind movers, as in movement.
Shifting.
Yeah, not just talking, if you remember. But then I spoke to my cousin who's a psychiatrist, and she said, well, before someone gets to that point, they're at a lower point, and at that lower point, you can intervene. Before someone's fully decided to take their own lives, they can find a way out.
You've just brought something to my mind, and it's something, and this is actually to do with the media, but also some of what this should be today, which is, and I might pronounce this wrong, it's called the Papageno effect. Papageno was in The Magic Flute, one of Mozart's operas, and he was feeling suicidal, but there's three characters that helped to find and give him hope to be able to realize he could be here tomorrow. So a lot about prevention is the embracing of lived experience. So people like Kevin Hines, if you ever read his book, And he talks about his experience of his suicide attempt and how the fact he is glad that he's survived, and that's giving hope to others. Even in their darkest hour, there might be hope. And just before we went on camera, I was talking about something that happened in my life that I didn't realize had such a massive effect. After Andy died, there was obviously, it felt like chaos, and the world was turned upside down. I felt like I was living on a different planet. And with everything that had gone on, there was media attention, there was police, there was lawyers. And when you feel you're at your lowest, we're kicked down again. We kept getting kicked down. And you think, how low can I go? And I recognized in myself that I wasn't in a very good place. So I'd gone to have some treatment with a psychologist. And having never been to anything like that, and maybe being a man as well, I felt that it was actually quite challenging. But gradually, as I gained more confidence and opened up, there was one day where we just had some more bad news coming through, and I was saying to the psychologist, I just don't feel fulfilled. I don't feel happy. I don't feel like I really need to be here. There's nothing in life that I'm gaining from. And the psychologist said to me, you might feel better tomorrow. And I didn't really realize the significance of that comment, but it was very much a kind of crossroads in my life where there was actually hope. And someone described hope as hold on, pain ends. Just like we're doing the cycle ride, as even in the absolute chaos, it was not going to be forever. And we talked about that a lot. And even where I was in a really miserable place, I could think, perhaps this isn't going to be like the rest of my life like this. Perhaps tomorrow might be something better. Perhaps tomorrow I might wake up and actually look out the window and think, do you know what's a nice day? It's these little glimmers. And the longer it's been since then, I realised how important that's been in my life, and sharing, how different my life could have been if I'd not had that support and treatment, how different my life had been if I'd not had that little bit of advice, which for me was really profound, actually.
I think that's really important. And like Payman said, we're lucky. I mean, I often seek refuge in podcasts, which is one of the reasons why I brought up to you, since the ADD diagnosis as well, and having a better understanding, because I chose not to medicate. It hasn't affected my professional life, I would say, because I think I've always been able to cope, especially as a high functioning woman, which is quite common for women to hide neurodivergence behavior. But I think that my mental health is like literally up and down. It's a constant up and down. And podcasts have been a really good way. And as I said, as you had quite correctly described, stories of people making out, they say the only way out is through. And I just think, oh my gosh, this person's been through this, and, it's really important that we find help. I think we're in a more privileged position, right? Because at the back of my mind, I think sometimes when I live in Notting Hill, and it's super diverse, multicultural area. And sometimes I see, just like Camden, you see drug addicts, crack addicts at 1 p.m. And since reading Gabor Mate's work, my narrative and my compassionate inquiry towards those people has completely changed. Because I'm like, how did they end up that way? We had somebody that was a previous addict that had come out, he'd been using since he was 12 years old.
Yeah.
But I think it's also the recognition that a lot of these people don't have the tools and support, a lot of them don't have that. And I think that's, where the difficulty lies. Dentists do, and medics will generally have lots of tools available to them. One thing that you said at the beginning of this talk, which I'm keen to delve into, is the GDC and our governing body. Yeah. Because I think since I graduated, I'm going to go as far as to say the thought of being ever investigated by the GDC, which might happen, makes me feel suicidal. And even when I've had a patient who's complained and wants some kind of financial, she has a financial incentive, they will threaten with the GDC, right? Because they know how scared it makes us. And that really makes me feel sick to the stomach, you know? Whether or not the GDC find you guilty is irrelevant. It's the fact that you have to go through that for several months and years. That, for me, I find terrifying, and I don't know what the answer is.
And you've raised a very good point where the Canmore Trust are running a wellbeing conference in November to address this particular issue with the GDC, the GMC, the Veterinary College, and they've invited representatives to speak at that. The thing is, like, how do we move to a compassionate regulation whereby we aren't just
shamed?
Well, yeah. And the thing is, if you went through the legal system, even the criminal system, you probably would be dealt with in a more of a compassionate way. And when I graduated in dentistry, I think I paid my first year's registration was like £40. It's ridiculous. And the worst thing you'd be doing is if your brass plaque outside the practice was of a wrong size. And I absolutely agree that patients need to be protected, but we also have to be compassionate to our healthcare providers because we are human. And I've seen some devastating effects of people who've been through the GDC. Even if they're cleared, it's feeling like that mud sticks, and it's there for everyone to see. And I think that there definitely needs to be engagement of understanding the proportionality of the charges, the proportionality of how they're dealing with people, and where is the support, especially now they're moving to remote hearings in an attempt to reduce costs. If that happened to me and I'm sitting at home, they keep my laptop, listening to legal terminology I might not understand, you know, I know that would have a devastating effect on my own mental health, and who's sitting there to support me and get me through this difficult time, because ultimately the GDC may not have our interests at heart. It's about protecting the public, but we're still human at the end of the day. And where we spend our time caring for people, we also need to be cared for too.
Look, it's no consolation for someone going through it now. But one thing that is becoming clear, I had Linda Cruz on, so dental legal expert. And he said the pendulum's definitely swinging back towards us from the GDC side, in that they may be about to start a program whereby it's impossible for a first offence to be struck off, for instance.
Really?
Yeah.
That's so interesting.
Yeah, and you know,
I guess that's dependent, right? Because if it would be something like,
of course,
Me Too or something.
But if you've never had a complaint before, and it's not going to even get to the GDC. He was telling me about a few things, and what he was saying was that definitely 2014 to 2015 was almost like peak GDC, where the GDC itself was getting bigger, and it was almost like an industry, you know, to get dentists. They put ads out saying, "Has a dentist hurt you?" and all that. But you know, what I'm trying to say is the fear of the GDC, particularly we get it with younger dentists. So it's not as bad as it was. Number one, and number two, as I say, it's no consolation for someone going through it now. We're much less likely to be put in that position. Yeah, much less likely.
But I think you're talking about is the expectation versus the reality, and this certainly is the catastrophizing of the fear of the GDC, and that's affected a lot of people's careers, where all you have to do is read the GDC Gazette, and you see this whole myriad
There's
of
still
things.
names, couldn't they? Yeah.
And that fear is enough to put off ruining someone's enjoyment of their job. And I've certainly been fearful, following some complaints, wondering if it's going to go to the GDC.
Yeah.
Every complaint, if I'm honest with you, every complaint, I'm like, is this going to end up? And patients know now, because they'll threaten you with it. Whether they just want money, they'll go, well, if you don't give me money, I'm going to report you to the GDC.
What's going through your head? What's going through your head when you're worried about it? Is shame the primary emotion?
I think shame is the primary emotion, because I've also had fellow colleagues and healthcare professionals been through it. And what I find also so disturbing is that the patient is patient A, and the dentist or doctor has their name dragged through the mud. I find it incredibly unfair, and I find that is unbelievable. And the fact that people can go just on the internet and have a look, and people can ridicule you, and I just think that since, I'll never forget, a year before I graduated, or was it during VT, they sat us down, Dental Protection came to give us a chat and was like, you will get sued at least like X times in your life.
So Len de Cruz also talked about that, and he said it used to be an opener that they all used to work at Dental Protection, and he said it used to be an opener to every lecture that they all used to use, and they realised that opener was causing massive anxiety because they were going around all the dental schools starting with that opener.
Massive anxiety. And the fact is, look, I've been long enough in this game, in the cosmetic game, to actually realise it's actually part of the job. Some people are going to sue you whether or not you did your job right. And Annika talks about this. Annika in the podcast was like, you put X amount of your money away per year and accept that that's going to go like to compensating something legal or giving the patient money back, you know what I mean? And it's part of the game, but they make us operate from a place of fear. And what I don't like is, in our profession, we are constantly operating from a place of fear. And I don't talk about just the GDC or our indemnity. What I talk about as well is like we operate from fear in the sense that you are here to serve, you should do X number of years in a hospital, you should do this in general practice, you should do this. It's always this should that is like looming over us. And I think my father's generation had it much worse when he talks about his years as well in hospital. So I've been operating from a place of fear for so long, fear that something's going to go wrong from the day I was in university.
And the other sort of side effect of it is you're communicating with your patients from a position of defence.
You're almost manifesting things happening. I know it sounds crazy.
My brother went for a dental checkup. He hadn't been for a while, and he said it was more like talking to a lawyer than a doctor. He said the guy was making me sign stuff left, right, and centre. He was saying, did you understand that? Did you understand that? And I really, it really hurts when he said that, because you almost feel like the lawyers have won. The legal system has won. And
it's taking the human element out of healthcare, and it's making more risk averse, and
we're all acting defensively.
It was interesting. I was listening to you speak there, Rhona, and something I was talking about actually on World Suicide Prevention Day is listening to understand and then listening to respond. And you've really hit the nail on the head again in terms of one of the challenges we have in dentistry, but also medicine, is a lot of us have these perfectionism traits in our personality. And the biggest thing around the GDC is the fear of not only what it's going to affect us, but how might we be judged by our colleagues, not just our patients. It's like, are we going to be hauled over the coals? Are we going to lose friends? And unfortunately, the perfectionism trait is one of a contributing factor to potentially bad mental health and suicide, sadly. But it's something that we all kind of have to be mindful of, and be working towards to help to keep our mental fitness as good as possible.
That goes back to vulnerability. When I was talking to my therapist about my own mental state, and she said that I suffered from something called toxic perfectionism. Do you know about it? Yeah. So toxic perfection is, the self-perpetuating belief that you're just never good enough. I might even get my description out that she sent me. And I constantly live in this, and it's always like, this thing is going to make me happy, or this, or this, or this. And then this constant, and, it can serve you well, right? Because if you think about parts work, I don't know if you've ever done parts work. So there's something called internal family systems. I don't know if you're familiar with it, but again, it's something I've worked on with my therapist and my coach. And, we're all made up of parts. So if Payman says, like, today I'm feeling anxious, no, part of you is feeling anxious. That's just a part of you. It's not you. Your identity is not anxiety. And it's really important. And then when you start to recognize all the different parts of yourself, they can all be in a boardroom together, and you're like, hey, anxiety, hey, this. And sometimes certain parts of you have actually served you well in life. So instead of shaming it, because I think for a lot of dentists, that part of you, that toxic perfectionism part, has actually made you be a high achiever, made you do well in your exams, made you be a provider, organized, whatever it is. So actually some parts of us has served us well, but it doesn't mean they will continue to serve us well for the rest of our lives. I think that that's really, really important to recognize, because it goes back to the vulnerability argument as well. So many dentists and healthcare professionals are not willing to be vulnerable. They're just not willing to have these conversations and be like, do you know what? I feel like I've got imposter syndrome, or I feel like my work's rubbish, compared to X, Y, and Z online. Because if we were having these conversations, we'd recognize we're all in the same boat and we're actually all connected,
Yeah. But I often think back to when I started my career, a lot of the interactions we would have is in person, where you could actually have these heart-to-hearts about maybe not feeling so good about things, but things that were going so well. And as we become a bit more online, especially during COVID, I'm mindful of the changes I've seen online, and I'm mindful of the things that I post about my patients, whether it's testimonials or befores and afters, and think, am I doing this for me? And could this have a negative effect? Because someone might be having a bad day and look at it and think, I just, or as an orthodontist thinking, I've just done a debond today and I didn't really like the occlusion at the end, but Angus has posted something that's better. And vice versa, I could look at it like that. But we're not having that discussion to resolve that, as in to understand the balance in how we're feeling. So,
yeah, I think also we've got to be active in the types of people that we follow online. And that goes back to the same thing, because comparison is a thief of joy. We know that. Our whole social media ecosystem is based on everybody feeling insecure, even the people that look like they're like living their best life. This system would not work unless every single person felt insecure. That's how it works.
The fact that you feel insecure just blows me away. It's madness to me that someone like you, they feel like you're not good enough. But having been sat with you through all these conversations, that's an issue you have. With you, you've been through so many different parts of our profession. So the hospital system, climbing up to become a consultant. Now in specialist practice, you've had corporates involved. I mean, the way we were introduced was through the people at Bupa.
Yeah.
What parts of our profession, we talked about the GDC part, but what parts of our profession do you think are the parts that you've seen have raised your anxiety levels, or that we could do better?
That's a really good question. I think it's actually a combination of self-compassion, being aware we're not superhuman. And I think, unfortunately, in orthodontics, getting in was so competitive. And it's not being big-headed, but you're top of the pile. But to get there, it's blood, sweat, and tears. You've been really going at it.
It really is.
And then during the training, you're constantly being pushed to excel, which is admirable, as we should be. But where's the kind of middle ground? Where is the enough is enough? And I remember Annika talking as well on the podcast. I think she'd had some challenges when she was applying to get into specialist training. And also during specialist training, I think there was an issue in 1 year. And I put my hands up when I was a registrar, because that's when I lost my brother Andy. And I'd said, I'm having a really bad time. I need to have help. And hats off to the people. It was Sue Cunningham, who's now Prof Cunningham at Eastman, lovely lady, a brilliant orthodontist and an academic. I told her everything that was going on, and she's hugely supportive. And without that, where would I have been? They didn't necessarily always agree with my decisions, because I delayed doing my exams by a period of time, and it didn't fit necessarily their schedule, but I did get through my exams. But I think the hard thing in these training environments is, what do you do when someone struggles? Because the conveyor belt of training continues, but someone is lagging behind, or someone has stepped off. And unfortunately, more often than not, people leave training. And there has been some flexibility on a very separate thing about from sort of doing part-time training, which can help. But yeah, I was lucky I got through it. There was I was bruised and battered, but I got my qualifications.
What about politics, hospital politics?
No, but
did that wear you down? Because that's a big part of.
Well, I think there's politics everywhere. I think that even politics where I work, not in a bad way, I think in a good way, constructive way. Certainly, when I left my consultant post, it was a period of time when management were really not very pleasant, and it was a lot of pressure to see more patients, to do more hours, to change our contracts, cutting costs. I was thinking, I trained all these years because maybe I was quite naive. I wanted to provide the best possible care. I could in some respects, but I realized this isn't for me. I actually want to care for people. I wasn't interested really on sitting on committees. I got the most out of interacting with families, patients, seeing them grow and develop as I do with staff. And that's what I'm really fortunate to be able to see now in the practices that I work in. But I didn't really get too heavily involved in the politics. And you can get sucked in, and you have the different camps for people who've got beliefs for this and that. When I always kind of thought what the big picture is, which is looking after people, because healthcare is just not just about health, it's actually about caring. And sadly, there's a lot of people who don't actually forget that.
Now that you're more tuned in to mental health, victims of suicide, families of victims of suicide, do you think there's a role for dentists in, intervening, maybe the wrong word, but in helping people with their mental health?
Yeah, absolutely.
Our patients.
That's what we're doing with this as well.
No, but for our patients, you see the patient every 6 months. Yeah, we're perfectly placed to spot. But someone like me, I'm not tuned in enough to. Well, I'm not a dentist anymore. But you're very sort of empathic with your patients, and you can tell if they're going in up or down. Have you had thought about that, or have you noticed with your own patients?
Absolutely, and even I think one of the things I've loved in my job is people feeling comfortable to speak to me.
Me too.
And it's like they're comfortable telling when they're not happy. And I always say, like, as soon as something doesn't feel right, tell me so it doesn't snowball. So over time, and I think it's a privilege that I've had parents tell me about the struggles their children are having or their own struggles. And an orthodontist isn't really about moving teeth. It's about psychology. It's about coaching people. And that's something I've really enjoyed. I think all
parts of dentistry, to be fair.
If you've got the time. And I think that's the struggle in the NHS, is you can do a technically good job on the NHS, but does the patient feel happy? Does they feel listened to? Have you managed their anxiety if you've not got enough time? And that leads to patient dissatisfaction and also dentist dissatisfaction. I had a patient last year, which really has stuck in my mind. They're being referred to me to replace a bonded retainer, which is not a big deal. And I don't often go into the waiting room, but this time I thought I'll go down. It's a new patient. It's nice to get to meet new people. And as soon as I walk into the waiting room and I said their name, I knew something wasn't right. They didn't look me in the eye. They looked distracted, like the 1,000-mile stairs. So we walked up the stairs. I was making small talk, but they weren't really saying anything. And they sat in the chair, and I started talking to them, and I knew something wasn't up. And this is something that's very important in preventing suicide, is listen to your gut feeling. Something doesn't feel right, you generally are onto something. So we forget the bonded retainer, and I started asking her, how are you feeling? She says, I'm not doing so good. Says, do you want to talk about it? Says, I don't really want to talk about it. Do you have any support at the moment? She says, yeah, I've been to a therapist, but it's not worth it. I don't feel like I need to be here. And it was all these alarm bells that kind of came up. And we just kind of chatted, and I let her talk. And this is the thing, if you've ever got someone who is suffering that's a mental distress, even if you don't know who they are, it's just listen. We spent the time, we spent 30 or 40 minutes. And she could tell me about her journey, what she's been through, how she felt worthless and hopeless. There's nothing I can say to make it feel better, but the fact is we were there to listen. And I think that's something we can all do. We don't have to give solutions. And then we followed up with the person. So 2 days later, I phoned them up and chatted to it. And they were just very grateful for the fact that we spent the time.
I mean, you said yourself, something as simple as tomorrow might be different.
Yeah, tomorrow might feel better.
You might feel better. Change the way you think about, you thought about your own mental health. Something as simple as that.
But it is the thing I've been talking about, is the compassion. And there's a lot of fear around about talking about suicide. And if you're worried about someone and you've got a gut feeling that something isn't right, a key thing we know is, if you ask someone, are you thinking about taking your own life? That doesn't mean you're seeding the idea. It doesn't mean that they're more likely to die by suicide. They actually might find it's a way that they can actually say yes. And it can actually be a huge relief in a lot of respects. And from that, we can then look to see we can get them support. But this is where, because there's not been enough of a discussion around suicide prevention, it's these conversations that are incredibly important. And I certainly had no skills in that previously, and I've been through some training. I'm certainly not an expert in it, but I feel in a better place that if I were in the unfortunate situation where I was to have someone I was worried about, I feel I could possibly handle it slightly better than I used to. Yeah.
I think it's really, there's two things based on what you were saying. First of all, I want to say the listening piece is really important. One of the best questions that I got asked was, or one of the best proposals that I was given was, do you want to be heard or do you want advice? And I think that's really important, because sometimes when people come to you with a problem, you start giving them a number of solutions and it actually makes them feel worse. Like there's definitely times where I'm like, this is overwhelming me and making me feel worse. Whereas actually sometimes you just want to be seen, and being seen is incredibly powerful. And you feel that you are not being judged for what's being said, and you just need to kind of have that release and that vent. So I think that that's one of the most important questions I've started to ask people. Do you want to be listened to, or do you want advice? And I think that's where we really need to start thinking about it that way. The other thing that I wanted to say is also the stigma thing is just so big, because I think that people relate death by suicide as being mentally unwell. And when I went through a really dark period of my life, I remember going to quite an old school psychiatrist, telling him about like the suicidal ideation. And he wanted to put a diagnosis on me straight away for a mental health disorder and put me on, quetiapine, which is a very strong medication. And I just said no. And I was like, no, actually, I saw him a few times, but I listened to my gut and was like, I don't think he's the right kind of person, because the conversation around those feelings is something's wrong with you. And that makes you feel even worse. Yeah.
But you brought up the thing about stigma. And it's one of the things, how we can change the conversation is how we use the language around suicide. And something that I particularly don't like was, after Andrew died by suicide, people talked about him committing suicide, and that just makes the hair go up on the back of my neck. And it harks back to really when suicide was a crime, implicating like there's a crime or there was a sin that's happened. Crazy. So it's nothing to do with political correctness, but by changing our language about how we talk about it, it's so that other people who might be struggling with those thoughts can feel more able to reach out for help. But if we're using terminology that is reinforcing stigma, then they're the ones who may not be seeking help, and then we've got another tragic death. So there's a lot that we can do in terms of talking about it that we can help others.
I think we have to make the media have to be held accountable. We talked about Caroline Flack off camera. I've talked about her on camera a lot. The media's narrative towards her. And again, it reminds me a little bit of the GDC, you ask, like, you are on trial. This person is on trial. It was the same with Caroline Flack. She was on trial for her behaviour. So that is responsibility. Like these people, these institutions.
The GDC by design is a court. It is. It's by design. It's not like it feels like it's a court. It is a court. Yeah.
But I think that's almost medieval to me. That's medieval.
Maybe that needs to be different.
Yeah.
For sure. I mean, what should someone do if they have suicidal ideation?
That's a difficult one. I think from our point of view, I think that...
Talk to someone, right?
Well, do you know, when we're thinking about men and women here, I think that anyone who is struggling with their thoughts to begin with, I think it's most important for anyone who's listening today, know that help is available. Sometimes those thoughts can be scary, and this is the issue of if someone had thoughts of taking their own life, it can be scary if they've never had anything like this before or heard about it before or heard that recovery can happen.
Yeah.
And reach out for help, but reach out for support as well. We've got obviously great charities like Samaritans, we've got Papyrus, we've got Mind. And there's
Confidential. Which is
Confidential.
Which is anonymous for dentists.
Yeah, but don't think you have to go through it alone. It's always amazing to think of the people who are compassionate that can support you through this journey. And I think that's what's really important. And I think that's the thing for us. On the other side of things, if you're worried about someone, is having the confidence to have that chat. And particularly if it's a man, if he says he's okay, ask him twice, are you really okay? And if you're still getting a no, or they say, coming back and say, I'm doing fine. If you then say, well, I've observed this about you, like you've been a bit withdrawn, you don't look yourself, you look quite distant. I'm worried about you, is trying to really extract that information and be persistent. And we often don't want to interfere with someone's private life, but it's important, and these are life-saving conversations. And if you are worried about changes in their behaviour that could be that they're worried that they might take their own life, ask the question, because it has been shown to be life-saving. It's not seeding the idea.
Have you seen that amazing advert? I don't know which charity it is. Remember, it made you cry. Those two older men, they're at the football, and then there's one that's
Norwich.
really and then there's one that's really happy, and the one that looks a bit more miserable, and the happy one's always trying to make sure the miserable one's having a really good time, and then it says like mental health doesn't always look like it, and then it was the really happy one that ended up taking his own life, which I think really labours the point that you never know what people are going through, what mask they might be wearing. And educate, like we need to educate ourselves, like don't shy away from it. I know it's not the happiest topic in the world, but when I got the book, I started reading it, and I think maybe it's because I've been in dark places. I really, really have. So for me, it was like, oh my God, I feel seen. Someone's seeing my mental health. Like that's what I felt like, and I wanted to understand more. And I think it's that education that's really key. And for some people, particularly in medicine and dentistry, I think it's really challenging because of cultural and religious taboos and stigmas around the conversation. And it's also not a topic of conversation which they feel maybe would propel them in their career, but your mind over matter. That's what I think.
Something you've taught me, Rhona, and you brought it up today, is that there's a spectrum all the way from mental fitness and optimization, all that good stuff, being at the top of your game, all the way to feeling suicidal. And you can move along that spectrum, and somehow talking about optimization is, everyone wants to talk about optimization, but when we get to the suicide side of it, now stigma creeps in.
Yeah, it's just not sexy, is it?
But it's the same subject we're talking about. Is how are you feeling? How's your mental health?
You've just triggered something in my mind. I've just remembered. So Mike McCarthy, who's the founder of the Baton of Hope, I've had some amazing conversations with him. And he lives in Sheffield, and there they've got a men's club called Talk Club, which is very simple. And when you go to Talk Club as a man, you're asked, how are you feeling out of 10? And can you tell me why? And I've used these kind of scales with patients in terms of how they're feeling about their smile or their well-being. It's incredibly effective. But I actually had the conversations with my kids. So my oldest boy, Fraser, he is probably a bit like me, a bit introverted, not necessarily going to volunteer information. Whereas Hugo, he's amazing. The conversations we have, he will volunteer information.
Everything.
Yeah. So I spoke to Fraser and I said, Fraser, can you tell me how you're feeling out of 10? and he gave me a number and then says, can you tell me why? He then talked to me for 20 minutes and all these things that I could hear about. He says, oh, I'm a bit worried about GCSEs, what subjects are going to do, what the teachers are going to be like. But that's a few years away, but I didn't know that. But sometimes by asking a different question, it opens up huge avenues of discussion because it's in a non-threatening way, rather than how is your day today? And it's like, it's fine. But think it on a different way. And we use that a lot with our teenage patients in terms of how they're feeling, how they're getting on, because if you're asked something directly, it can feel quite threatening. Whereas if you're having to reflect upon your thoughts and your feelings, the answers you get are amazing.
As an orthodontist, you get to see a kid go through. I mean, one of my kids went through 2.5 years of ortho, and then right at the end, we sat with the orthodontist and said, right, let's look at the pictures right at the beginning and right at the end. And the pictures right at the beginning, to hell with the teeth. He was a child at the beginning, and at the end, he's a teenager. You know, and so you see a family go through that period, and a teenager. I mean, it's a difficult time being a teenager, isn't it?
Oh gosh, yeah.
It's kind of a privileged position as an orthodontist. You get to see them.
They're so different. I absolutely love it. And one of the most important lessons I learned when I was training at the Eastman wasn't the technical bit, but we had a psychologist who came in, Sarah Portnoy, I think that's right. And she said, when you're talking to teenagers, don't just criticize their toothbrushing, don't just criticize their appliance wear, because they're going to switch off. This is where I learned the scale out of 1 to 10. If you're asked them, how are you getting on with your toothbrushing? And I say to my patients, a 10 is I win a gold medal at the Toothbrush Olympics. A 1 is I lost it 2 weeks ago. So there's no judgment in that. And then 99.9% of the time, they're right. They'll say, I'm a 5 out of 10. And you say, well, can you tell me why? And then you say, well, I brush 1 time a day, and that's probably for about a minute. I don't say, well, which end of the toothbrush are you using? But it's much more engaging. You're bringing the patient along with you, because it can be so easy to just slap someone down and says, you're bad at this.
But dentists are really bad at that, by the way. I'm really shocked, because I did a video on TikTok that got 8 million views. It went really viral, and it was come along with me as I watched this girl. And this girl basically expressed that she hadn't brushed her teeth. Well, she calls it a hot minute. And she says because every time she brushes her teeth crumble and fall apart. And basically you watch her, there's a 3-minute video, every single tooth is covered in gross calculus, the girl is panicking, and I did a really compassionate review of the video, and the amount of positive feedback that I got back was, thank you so much not for judging her.
Yeah.
You don't know what people are going through. There have been loads of dentists that have been really mean to her on this video. There have, my dentist speaks to me like I'm trash, but I was actually going through depression. I couldn't get out of bed. My bodily and oral hygiene completely suffered. Yeah. And I was like, it's so basic, but I've had so many patients that have actually been shamed by their own dentist or healthcare professionals about not brushing their teeth, having good oral hygiene. We don't know what people are going through. I'm not saying that I'm giving people a free card to just do what they want. I'm not telling you to go and have a pack of fags for breakfast. But
You're right. You're absolutely right that there are some dentists like that. I think, number one, our dental education, we've talked about this a million times, right? What bits of the course would you take out? And what new bits would you add in? And definitely something around mental health of yourself and of your patients.
100% should be on the curriculum.
And then what you're saying here, empathy, not sure if it's teachable as much, but something you should bear in mind here is that some people were treated by a dentist who told them off.
Yeah.
And they see that's the dentist's job, to tell you off. Mm. Yeah. And it's so interesting because what the dentistry that you had as yourself as a child kind of defines what you think is normal as dentistry, whatever that was. So I was treated by the same guy who treated us in Iran before we came, and he happened to go to Harley Street. So I thought Harley Street was normal. Yeah? Then I go into my VT practice thinking, what the hell is this? Yeah. The next person had a bossy dentist. He thinks that's the normal.
I think it's different. I mean, I had a horrible orthodontist, horrible. And it was the worst experience ever. But also, I wasn't super compliant, but also, like, my parents couldn't afford to be around and make sure that I could go to appointments. So there was complexity in my social environment at the time, which meant that I was in braces for 6.5 years. And my
6.5 years.
So my orthodontist was, like, not great, and he obviously was resentful of being on the NHS. I still wanted to be a dentist, and I was like, I want to be a very different dentist to him. Do you see what I mean? So
sometimes you want to be the opposite.
Yeah, but it's the same as when you look at people that grow up in abused homes or addict homes. Either they follow in the footsteps or they become the complete opposite. You know, that's quite common. So I think that what's lacking in the education system and perhaps in the selection process, a lot of people will choose dentists based on certain accolades without actually assessing whether they are right to be a healthcare professional. I was deemed to be not desirable to get into dental school and pretty much rejected from every part of my dental education, not the A-level GCSE part, because I was deemed to be too airy-fairy, too this, too that, because of the character I am. And actually, that served me. That's my superpower. My patients are my superpower because I have that understanding. But in dental school, they didn't see that.
But people misjudge you, man.
They do misjudge.
It's part of the feature of being loud and proud that people get you wrong. It's your biggest strength and your biggest weakness at the same time.
But why as dental care professionals, healthcare professionals, do we want somebody to be quiet in the corner and slaving around and just, like, writing academic papers or doing research studies? Why is that considered within the community, not my patient community, within the medical healthcare professional community? The more quiet you are but doing research and ticking those academic boxes, the more we're going to look up to you.
People like us do things like us, and no one wants anyone to rock the boat and change things.
It's a conservative profession.
Yeah, and I think even orthodontics is a very small world, and you think of everything I had to do. I was a kind of a chameleon. I changed myself to be the person they're looking for rather than the person who I am.
That's what I did.
And hence why, I'm in a much better place myself, because I'm doing my authentic self now in terms of caring for my patients and feeling fulfilled. But to come back to when we think how we speak to our patients, this perfectionism trait that is detrimental to our own mental health is why we sometimes struggle with relationships with patients or with staff members. If I think of staff members who, when I was younger, because of my drive and determination, if they weren't as driven and determined and hardworking as me, I would kind of judge them internally. I might not express that, but they're still doing their job. But the same with our patients. A really difficult thing with orthodontics is compliance. But no one is a perfectionist like the orthodontist might be. How do you get them through wearing their liners,
it's a very good point.
wearing their elastics, or brushing their teeth? Not everyone can be at the very top end of that curve. And how do you handle that and still maintain a good relationship? Yeah.
No.
By the way, you think we have egos in dentistry? Orthodontists. I was going to sell a product to orthodontists, looking to sell a product to orthodontists. And I wanted just to talk to some orthodontists just to see what they thought of the idea before going ahead with it. So I called Tracy Posner.
Yeah.
She used to run the British
BOS.
Orthodontics BOS event.
Yeah.
So I said to her, look, who are the top 30, 40 orthodontists in the country? Let me just go see all of them. My God, the egos. Like it surprised me having been with dentists continuously. There were egos and disagreements. You know that old thing about 6 orthodontists, 7 opinions? it was like 6 orthodontists, 23 opinions. There's so many different ways. And you think it's so weird, because as a dentist, you think you kind of know what's going on in that world,
Yeah.
But so many different ways of moving teeth and different opinions and strong opinions on how things should be done.
Yeah, it's orthodontics, it's science, but also art.
Yeah.
And it's the art that we really, there's huge arguments about, what's right and wrong. And I often say to patients, there's so many different ways I can get you to the end point of treatment, but what is going to be the right thing for you? And often they're more of the judge than I am. And I've sat in the periphery of a lot of online debates regarding things like myofunctional appliance, 6 month smiles, GDP ortho, etc., etc. And it can get incredibly toxic. But if you step back and say, look, at the end of the day, we just want to look after our patients. A lot of it is kind of semantics between different things, but it is about caring about people. But there's the keyboard warriors can really...
Oh my God, they're terrible. They're literally, I mean, they create pages about colleagues like completely...
I had a guy here sitting where you're sitting, ex-Goldman Sachs. He's now owns 14 dental practices. And I said to him, what surprised you the most about dentistry? And he said, the egos. And I was really, so I was like, I said, what, there are bigger egos in dentistry than in banking? And he was like, 100%.
Yeah.
I was really surprised.
I think it is really difficult. Angus.
It's been a massive pleasure.
Yeah, you are amazing. And thank you so much for the work that you're doing and coming on here and talking about a topic that's incredibly close to my heart. I would love people to be able to connect if they need more help. Could you perhaps give some information about where they can find any more information with regards to all of this?
So I think the first place is like education, and just like when I gave you the book, When It Is Darkest. Like I'm really someone talking through lived experience. I'm not a therapist. I'm not a psychologist. But to actually understand the backgrounds to mental health and suicide awareness is incredibly important. I think in the dental community, engaging with the charities, particularly the Canmore Trust, where they're doing a huge amount of work supporting dentists in difficulties, but also looking to see, can we get a more compassionate regulation? And there's a lot of stuff that's going on online. And if you look at my Instagram, I've done a lot of posts regarding mental health, different well-being things. But I think it's the collective voice that we all speak together is most important from that point of view.
What's your Instagram?
Yeah.
Angus Pringle at Orthodontics. And Angus Pringle as well. So
perfect. Thank you so much, Angus.
Pleasure.
It was
Thank
amazing.
you.
Thank you for having this conversation. It can be life-changing for people and life-saving. So thank you for taking the opportunity to invite me.
Thank you so much.